Mr. Speaker, I am looking forward to hear what Senator Halwale will say this as a medical practitioner who is familiar with most of the things dealing with this bill. But you can see this bill arose when COVID struck us, and the last record of containment of such a serious disease were running back into the 1920s. And the country found itself in a panic mood and were using everything possible to contain COVID. The one very good, important method of preventing disease is by, cleanliness and availability of water reduces disease by more than 50%. Therefore, when there was sanitizers and hand washing promoted, hospitals were almost empty in the country other than COVID patients. And that goes back to the basis of this, that first and foremost, you need water in the country. That's what will stop typhoid. That's what will stop outbreaks. And there are many other dangerous outbreaks like Ebola, which really kill doctors and kill health officers and, kill the number of patients. And again, all that did not have a framework. And therefore, this act was developed to try to deal with that. But when you look at Part 4, Management of Primary Health Care Services, then it goes, the ministry responsible for health shall, in the management of primary health care services, formulate. So, the ministry, under Schedule 4, health is devolved. So, the ministry should be handling the policy. And in the whole of this act, there's nothing about the financing of healthcare. So it's left with the ministry responsible. And up to now, health services, the monies have never been devolved. There is so much held at the national government, a lot of procurement, including of medicine. Everything is national government, and the counties are left begging the minister responsible for health. And there is such a chaotic manner of handling health services generally, other than when you have an emergency, like the case of corona. And therefore, there is a need to make a law. Although we have gone back to the village and we have defined community health worker must have these sort of qualifications, the question is, how many community health workers are we training? Even the body, even the Kenya Medical, training college, which I'm happy we have students in the Senate today, is still a national government affair. It's not a devolved affair. And it is distributed in such a way that some regions in the country don't have a lot of these services there. And therefore, and the few people we train, they get absorbed abroad. They go to Botswana, they go to UK, they go to US for further training and never come back. Why? The county system has not been empowered enough to protect doctors and even to keep a doctor of a certain level in the village. And therefore, the way this has been defined, just like the act we dealt with yesterday, we need a little bit more of as people who protect devolution, a little bit more of protection of devolution in the way and the manner we have framed this. We have left all of it to the county government. When you form this, the national committee, you only have a COG representative. COG is so huge that you cannot have just one person from COG or their representative who could be the chairperson of the Committee of Health, and then it's just 1 out of 9. I mean, it's no longer a county affair. This matter must be devolved to the county, and the county should take a full charge. And more important, we have not talked about the financing at all. It's been abandoned. And just that training of medical personnel in this country, most of them will not work for the government. After some time, they run their own private hospitals, and even some who are still working for the government are directors in private hospitals. And therefore, we have minimum, going to the people through the government, the county governments and the national government, as far as healthcare is concerned. Then there is the issue of data. that particular officer in the village keep his serious data with them. Even for security purposes, it's dangerous. When you look at Kenya differently, you know, we have different parts of Kenya with different security challenges. So if a community health officer has all the data of the village, if I'm a person against the security of the nation, that is the person I will completely apprehend and take hostage while he has all the data and he has no protection and there's no mechanism of protecting that particular data. So just like in the training of pilots in this country, similarly has happened with the training of health. We train and the best brains are taken away to work from our country. And it is something we need to think about seriously. How do we train these community health officers and how do we make sure they are employed? We have a lot of them who have come out of training.